Happy Tuesday all, and welcome to the Empowerment Show. I'm Melissa Heisler, Empowerment Coach at It's My Life, and it is your life. Live it. Today I am joined by Anatoliy Pak, who has some interesting views on how the current healthcare system encourages disease instead of wellness. To join our conversation, post your questions at facebook.com/The Empowerment Show or twitter.com/Empowerment Show. My guest is Anatoliy Pak, who has dedicated much of his life to cultivating an intuitive ability to help discover what people need to find their individual harmony and balance. Anatoliy has a Master's of Science degree in Traditional Oriental Medicine from Pacific College of Oriental Medicine and certification from the National Certification Commission of Acupuncture and Oriental Medicine. Welcome to the show, Anatoliy.
Thank you so much for having me.
We're really excited to have you here today. This is one of the topics that is near and dear to my heart. And we had met, I think it's over a year ago now. I had heard you speak at a group, and two of the figures that you brought up during this group really surprised me. The first figure was that 17% of the United States gross domestic product, which was, I think, $2.4 trillion in 2008, actually went to healthcare. And the other figure that surprised me was that the second thing that surprised me was that the third leading cause of death in America is iatrogenic deaths, or deaths related to medical treatment, usually because I believe the proper drugs were prescribed, but they actually cause negative effects. Can you tell us more about this information and where you got it from and how you use it? What do you think it means?
Yeah, I think I got the information from the American Medical Association journal, and the article was written quite many years ago, so it's quite outdated numbers now. 2017, it's going to be $4.3 trillion that we are going to spend on the healthcare, which is about 4 times more than we spend on national defense budget. So I don't like numbers, I like comparisons because numbers are quite intangible, but when you see that it's like way more than we spend to support our defense, like our army and all that technology, including the space technology, and it's like, and that, it's quite striking. So another fact that I would like to mention is that we have the most expensive healthcare system in the world, meaning that we spend the most money per capita for the medical reasons. And at the same time, I think the level of health, or I'm not sure, but something like the longevity, the lifespan, I think we are 27th or somewhere in that part in the world. Meaning that having the most expensive healthcare system and living like and being on the 27th place in the world, like on the span, is something quite paradoxical.
So we're 27th low.
When I try to kind of understand, yes, 27th low, and behind many countries that consider to be like underdeveloped, and just try to understand why is it so. If you look the way how health is perceived in the United States, we can easily identify those factors that actually people's lives shorter, and more importantly, the quality of life is way below like normal standards that would be considered in terms of happiness. because living life doesn't mean having vitals like heartbeat and breathing and ability to digest the food and so on and so forth be present, because all those folks who are unfortunately in a coma state or like in the emergency room, like intensive care units, they are considered to be alive because everything is working, but we cannot consider like that they are living normal life. You know what I mean? So quality of life is as much important as the duration of the life. So going back to the healthcare crisis and to the expensive medicine that we have now, it's not necessarily like that straight connection between the more expensive the better. It looks like that we are lacking something principally important in modern healthcare, which is consideration of the human body as the better option to maintain and restore the health, rather than counting on the scientific research and magic pills in form of pharmaceutical drugs in order to restore the health, or rather in order to fight the disease. So restoration of the health and fight of disease are like two very important concepts that are kind of contradict each other in the modern healthcare. Rather, concept of health restoration and preservation at all in modern healthcare system that we have now. And this is from my point of view, is the major kind of agency that actually has led the modern healthcare to the state that we have now, which is absolutely like in crisis mode.